The topic of discussion in this module is necrosis. What do you mean by necrosis? Death of a tissue in simple language is called as necrosis. Localized area of death of a tissue followed by degeneration or degradation of tissue by hydrolytic enzymes liberated from the dead cells is the pathogenesis of necrosis. And the changes occurring in the necrotic cell injury are as follows. Increased cytoplasmic eosinophilia and the nuclear changes in the necrotic cell. And the nuclear changes in the necrotic cell is pycnosis, karyorrhexis and karyolysis. Now let us talk about what are the various types of necrosis, in which the first one is coagulative necrosis. Coagulative necrosis is most common type of necrosis, which is mainly caused due to ischemia, which is sudden cessation of blood flow, and it is also due to bacterial and chemical agents, but it is rare. And the commonly affected organs are heart, liver, kidney and spleen, but the most common organ which is involved is heart. Here the Zenker's degeneration necrosis also comes under coagulative necrosis. But the coagulative necrosis is not seen in brain, because in the brain it is liquefactive necrosis. And in the coagulative necrosis, an important morphological feature what you should know is tissue architecture is preserved where it is not damaged at all. And it is associated with the tombstone appearance of the tissue. What about the pathogenesis? Denaturation of enzymes and structural proteins because of the coagulative necrosis caused either by the accumulation of lactic acid because of the ischemic mechanism which is inside the cell, or heavy metals intracellularly, or exposure of cells to ionizing radiation. So here the necrotic cell breaks into fragments that are removed by phagocytosis of the cellular debris. And what about the gross appearance of coagulative necrosis? The tissue of coagulative necrosis is pale, it is firm, it is slightly swollen in the early stages. With progression, they become yellowish, softer and shrunken. And if you see the microscopic picture of coagulative necrosis, the cell outline is retained but cell cytoplasmic and nuclear details are lost. Necrosed cells are swollen and appear eosinophilic more than the normal and shows nuclear changes, that is pycnosis, karyorrhexis and karyolysis. And eventually the necrotic focus is infiltrated by the inflammatory cells and the dead cells are phagocytosed, leaving granular debris and fragments of the cell. The best example under coagulative necrosis is myocardial infarction, where infarct changes with time. In the initial event of infarction, that is under myocardial infarction, that is 8 to 10 hours, the tissue is pale, highly discernible, and microscopically there will be a cellular swelling, pycnosis and eosinophilic cytoplasm is seen. As the time progresses, that is up to 18 to 24 hours, infarct is grossly pale and sharply circumscribed and hyperemic borders are present. Under microscopic changes, heavy infiltrate of leukocytes are seen and macrophages are seen with loss of nuclei. By the time of 3 to 7 days, the tissue turns yellow-brown color with soft consistency and hyperemia at infarct borders. By the end of first week, the circumscribed infarct with highly vascularized scar tissue is present, and microscopically it shows prominent fibrovascular reaction in the margins. And by the 6th week, there will be a total replacement by means of scar called as myofibrosis. So here the coagulative necrosis is seen in Zenker's degeneration necrosis more commonly, which is greater than dry gangrene, greater than tuberculous infection, then the wet gangrene. And this is what is about coagulative necrosis. And the second one is liquefaction necrosis. The liquefaction necrosis is also called as qualificative necrosis. In liquefactive necrosis, the dead tissue undergoes softening and transforms into liquefactive viscous mass. It occurs mainly because of ischemic injury, but most common cause of liquefactive necrosis is bacterial, and other causes are fungal infection. And the main pathogenesis or mechanism under liquefactive necrosis is due to lysosomal permeability and release of these lysosomal enzymes. Example is the infarct brain and abscess in a bacterial infection, which is mainly seen in the CNS due to lack of extracellular architecture in the brain and rich in liquefactive hydrolytic enzymes. And in this condition, the tissue architecture is lost under liquefactive necrosis. What about the gross appearance in the liquefactive necrosis? The affected area is soft with liquefied area containing necrotic debris, and the cyst wall is formed later. Microscopically, the cyst wall is formed by proliferating capillaries and inflammatory cells. Cystic space in such condition contains necrotic cell debris and macrophages filled with phagocytosed material. This is what you should know about liquefactive necrosis. And the third type of necrosis is the caseous necrosis. Caseous necrosis is the combination of coagulative and liquefactive necrosis. It is most commonly encountered in the tuberculosis, mainly due to hypersensitivity reaction. But it is also seen in the conditions like syphilis, histoplasmosis, and coccidioidomycosis. What about gross features? The tissue appear as, or the necrotic area appear as, cheesy material. It is soft, granular, and yellowish in color. Caseous material is formed by the release of lipid from the cell walls of Mycobacterium tuberculosis and systemic fungi. And if we talk about microscopic features, eosinophilic material with cell debris surrounded by the specific granulomatous inflammatory reaction is seen. And the caseous necrosis may undergo dystrophic calcification. And the fourth type of necrosis is the fat necrosis. Necrosis in the adipose tissue due to action of activated lipases can cause fat necrosis. The best example under this category is acute pancreatic necrosis. In the acute pancreatic necrosis, there is liberation of pancreatic lipases either due to injury or inflamed tissue, which results in necrosis of the pancreatic tissue that leads to degeneration of the fat which is located in the pancreas and finally leads to fat deposition which occurs in the peritoneal cavity. In fat necrosis, neutral fat present in the adipose cells which are hydrolyzed into glycerol and free fatty acids, and the damaged adipose cells assume cloudy appearance. Now what about the calcium soap formation? The formation of calcium soaps is called as saponification or chalky white deposition, which are formed with leaked out free fatty acids and calcium complex. What are the gross features in fat necrosis? The affected area is firm and yellowish, where you can see white deposits, which is mainly because of the formation of the calcium soaps shows chalky white appearance. And microscopically, the necrosed fat cells show cloudy appearance surrounded by an inflammatory reaction. Amorphous, granular, and basophilic material is identified with the formation of the calcium soaps. This is what you will see in fat necrosis under microscopic picture. Next is fibrinoid necrosis. Deposition of fibrin-like material with staining properties of fibrin such as phosphotungestic acid, hematoxylin, seen in immune vasculitis and malignant hypertension. Microscopically, it is brightly eosinophilic, hyaline-like deposition in the vessel wall which is surrounded by the necrotic debris. And the rupture of the blood vessel causes local hemorrhage in this type of necrosis. By this, we completed all the different types of necrosis and also its gross as well as microscopic picture.